name's Mehgan, and I'm a chiropodist at Simcoe Foot Care and Custom Orthotic Center. I've been practicing chiropody for about 10 years.
And my name's Ben. I'm also a chiropodist, and I've just joined Simcoe Foot Care this past year. So one of the things we get asked the most is what exactly is a chiropodist and what our scope of practice is.
So in Ontario, chiropodists and podiatrists are the only foot care specialists educated to provide assessment and treatment of the foot. We can do things as simple as nail and callus care, up to more complicated things like diabetic foot care, biomechanical conditions such as plantar fasciitis, and even provide soft tissue surgery and prescription of some medications. So the other most commonly question we get is, what is the difference between a chiropodist and a podiatrist?
So there's not a school in Canada for podiatry. Therefore, podiatrists are trained in the United States, and they complete a residency program and are considered medical doctors. They're able to perform bony surgery, whereas chiropodists aren't medical doctors. We are foot specialists and can perform soft tissue surgery. As you can see from the chart, there's a few other foot care providers that have various levels of education and a range of scope of practice.
So a typical day in our office includes seeing a variety of patients of all ages for all different conditions. In this video, we're going to go over some of those more common conditions like diabetic patients, ingrown toenails, biomechanical concerns, arthritic conditions, and pediatrics. Then we're going to go over what a typical first appointment may look like, our custom orthotic process, and even look at how we sterilize our instruments.
We provide diabetic foot checks to prevent diabetic complications. We do this by testing the circulation and sensation of the foot. We are able to manage and prevent these complications by providing diabetic foot care, completing these diabetic foot checks, and providing patients with education related to their foot health.
We also specialize in treating conditions relating to the biomechanics of the foot, such as strains and sprains, bunions, plantar fasciitis or heel pain, Achilles tendonitis, ankle, knee, and hip pain, and even shin splints. Some ways that we treat those conditions include custom orthotics, low light laser therapy, therapeutic taping. We can provide orthopedic footwear and do footwear modifications. Sometimes we do cortisone injections or prescription of anti-inflammatories for painful conditions. We see patients of all ages, including children, for conditions such as in-toeing, ingrown nails, plantar warts, and orthopedic concerns.
At the other end of the spectrum, senior patients seek our attention for assistance with nail care, callus reduction, circulatory concerns, general foot pain, and mobility issues. We also commonly treat ingrown toenails, both conservatively and surgically. In chronic cases, we provide nail avulsion surgery to remove part or all of a nail permanently. In cases where infections occur, we can also provide antibiotics for a patient.
Arthritic conditions can also be assessed to offload pressure areas, reduce painful callus or corns, and provide footwear advice to accommodate structural changes.
So this is one of our treatment rooms. The first thing we do when we get a new patient in is we do a general foot assessment. So we always start with pulses to check circulation in the feet. In patients that we have a hard time finding the pulses in, or we might be a little more concerned with the circulation, we like to use this Doppler to listen for the pulse in the feet. So we apply a little bit of cool gel to the foot and place the Doppler on to find the pulse. The next test that we do specifically for our diabetic patients is a neurological examination, and one of our tests uses this monofilament device. It's just a small piece of plastic that's going to test the bottom of the feet, the sensation at the bottom of the feet. So I'll have Mehgan here shut her eyes and just say yes if she can feel the touch. Next, we look for the integrity of the skin, so we're looking for any callus, corns, warts, fungal infections, fungal nail infections, any breaks in the skin, infections, or ingrown toenails. If our patient's main concern is related to the biomechanics of their feet, we like to check the range of motion in their feet. We like to do some muscle testing, as well as get the patient to stand up so we can observe their feet. So we also like to have the patient stand up so we can observe the feet while the patient is weight bearing, to check the integrity of the arches. As well, we look for any bony prominences that might alter the way that the patient's foot operates and moves. We also like to perform a gait analysis of a patient to observe the way that the patient walks, to better understand the mechanics in that patient's feet and their overall body. Some patients will require custom orthotic intervention. We start this process with a full biomechanical and gait analysis, as we just showed you, looking at the range of motion in all of the joints of the lower extremity and watching the patient walk. Then we cast the patient non-weight bearing, holding the patient's foot in a neutral position to capture how we want the orthotic to hold the foot. There are all sorts of custom orthotics out there. We are able to fully customize the device, including shell type, length, and specific modifications to accommodate the patient's issues. We then send the cast of the feet with our prescription to our orthotic lab, and they send back the finished product. If necessary, we can make in-house adjustments to the orthotic.
We can also provide off-the-shelf insoles that we modify in-house to address the patient's needs. These work best for patients who may not require a true custom orthotic, or as a starting point to see if the patient is a good candidate for a custom orthotic. A custom orthotic will differ from the off-the-shelf insole as it has been casted to the foot.
Sterilization of instruments in the clinic is very important to prevent cross-contamination and keep patients safe. All of our instruments at Simcoe Foot Care go through a thorough sterilization process. We follow guidelines set out by our governing body and provincial standards. Everything is recorded and documented.
After instruments are used, they are removed from the room, rinsed and brushed, and placed in our ultrasonic cleaner, which removes any physical debris. Instruments are dried and packaged, then brought to our steam autoclave for sterilization. We label each package for our records. The packages and indicators change color to show the sterilization process was successful. Now the instruments are ready for the next treatment. So thanks for watching our video. I hope you learned something about chiropody. If you're looking for a chiropodist in your area, you can check the link at the end of our video. Or if you're in our area, you can check out Simcoe Foot Care.
Yeah, thanks for watching.